Welcome to the Healing Pain Podcast with Dr. Joe Tata. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tata.
Hey there, welcome back, friends, and welcome to this week's episode of the Healing Pain Podcast. I'm your host, Dr. Joe Tata. Today, we're talking about psychological aspects of pain rehabilitation that physical therapists perceive as important. Typically, when we're talking about research or a new topic or providing new information, oftentimes I'm talking to a pain researcher, maybe someone with a PhD or someone who's actively engaged in investigating different aspects of pain from a lifestyle and a biopsychosocial perspective. Today, I'm introducing you to Alexa Knuth, who's actually a student physical therapist. Alexa is currently a student at Robert Gordon University in Aberdeen, Scotland. She's in the last year of her program, and she's excited to start her career. But even before she started her career, she's already started to delve into the evidence and contribute to the evidence base by writing a paper called Psychological Aspects of Rehab as Perceived by Physical Therapists. You can all access that. It was actually published in 2018, but I came across and I thought it was really important to share with all of you. So we're going to be talking about that today on the podcast. Alexa also has an interest in working with and applying psychological techniques to a specific patient population, which is those who are looking to self-manage inflammatory arthritis, things like rheumatoid arthritis. So lots of great applications for this work here today. We'll talk about that on this week's episode as well. But overall, on today's episode, we'll talk about the important psychological techniques that people can use for self-management and which physical therapists perceive are the most important. As you know, psychologically based care, psychologically informed physical therapy is something we discuss often on this episode, and we teach courses on that at the Integrative Pain Science Institute. You can go over and check out our courses, as well as the newly released Psychologically Informed Pain Practitioner Certification. That's a complete certification that discusses the different multimodal approaches that you can use with regard to cognitive and behavioral interventions, as well as whole health interventions for treating people with chronic pain. Okay, without further ado, let's begin and let's meet Alexa Knuth. Hi there, Alexa. Welcome to this week's show.
Hi, Joe.
It's great to have you here. I'm excited to speak with you.
It's very great being here.
Thank you. In a couple of moments, we're going to talk about a paper that you published in 2018 with regard to the psychological aspects of rehabilitation as perceived by physical therapists. Everyone can find that paper in the Journal of Physical Fitness, Medicine, and Treatment in Sports. But before we begin, tell everyone about you, where you currently are, and the unique education that you've pursued.
Yeah, absolutely. So I am in my final year of my PhD program, or my DPT program. I go to school at Robert Gordon University in Scotland, and I am currently just finished up my data collection. I am doing my PhD on this, trying to co-develop a self-management intervention for patients living with inflammatory arthritis. I recently just moved back to the States, and I'm finishing my program remotely, and I hope to begin a future career as a physical therapist at the end of the year in America.
Awesome. So you mentioned you're going to Robert Gordon University in Scotland, and that program is unique in the way it's set up. Can you explain the difference between that program and maybe a DPT program we might find in the United States?
Yeah. So Robert Gordon University is a CAPTE accredited program. So it's really nice that I was kind of able to go abroad and kind of have that amazing life experience and work in the UK for a few years. And also go to school and then be able to transition back into America and become a physical therapist. So it is similar in the way that it was supposed to be 3 years of an education as the DPT programs here, but just everything with the pandemic, it got pushed back a little bit. The reason why I wanted to go to this program in particular is that they're very research heavy. I have a large interest in doing research, and I kind of want to continue that. And so in order to get my DPT there, or my PhD, I would have to kind of go through the entire PhD dissertation process, conduct a study, and things of that nature.
So in the US, you receive a DPT, but in Europe, it's considered a PhD.
Correct.
really interesting. I love that format. I wish more DPT programs actually had that, 'cause I think more professionals would pursue research like you did with your paper there.
Yeah, I've done research. I started doing it I went to SIUE, which is Southern Illinois University in Edwardsville, in my undergrad, and I did my master's there as well. And they have an amazing undergraduate research program where I got integrated into it like right away and just kind of kept up with doing research till today. So
Excellent. So let's dive into this paper that you published. So as you know,
yeah.
The reason why we're interested is because on this podcast, we talk a lot about psychosocial factors. And PTs are really in a unique position to implement the psychosocial with the physical. Yet there's some questions about, does this fit into our scope of practice? What should we be doing? What works? What doesn't work? What's acceptable? So as I mentioned, that paper is called Psychological Aspects of Rehabilitation as Perceived by Physical Therapists. Tell us what the aim of that study was.
The aim of it was to really try to understand from a physical therapist perspective what they kind of believe to be, the most important psychological and social factors that impact on our daily practice. And I was interested in knowing, from a physical therapist point of view, like, what do you see most often? What do you find to be kind of like the successful and unsuccessful coping behaviors of patients? What was your training like? What was your education like? Do you feel confident in being able to kind of address these problems that we see in everyday practice? So that's what I was really curious to find out.
Yeah, and that's why I was so interested in the paper, because you did cover a lot of important topics in one paper, which is wonderful. PTs do encounter a lot of different psychological and mental health challenges within their patients in practice. What did your survey find?
So my survey found that the top three things that were most encountered, and taken into consideration too that most of the people that answered the survey were outpatient and home health. And it was very much kind of geared towards like musculoskeletal conditions as well. So I just kind of want to point that out before we continue any further, because that does, kind of show the population that we are talking about. But the big things for musculoskeletal conditions were stress and anxiety, depression, as well as problems with pain management.
Thanks for clarifying the point on the survey data. We probably should just mention, so the survey was it done in Europe, or was it done in the United States of America?
So it was done in America. I did this as part of my master's thesis when I was at SIUE. And so the way that we went about it is I initially emailed all 50 of the APTA organizations in every state. And then quite a few got back to me. Multiple states got back to me. And I had about 100, just under 100, it was 95 physical therapists answered the survey completely. So this is data from that.
Excellent. That's really helpful. So those are the psychological conditions that are encountered by PTs. What are the interventions that you found that PTs are using most? You have quite an extensive list in the paper.
Yeah, I tried to do, I took this survey from actually a paper that was done in the UK looking at athletic trainers and psychological conditions that were found in there. And then I talked to him, got his permission, and then I just kind of edited it to fit what the physical therapist would kind of see. But these were the psychological interventions that I had listed. And what came up to be the most was creating variety in the rehab exercises, using short-term goals, encouraging positive self-thoughts, effective communication skills, and reducing stress and anxiety.
Positive self-thoughts, reducing stress and anxiety, which makes sense because that's in line with the conditions that often are encountered. And what were the other top two you mentioned?
So the top one was actually creating variety within different rehab exercises and using short-term goals.
Short-term goals, which is, I think, as a whole, our profession does short-term and long-term goal setting very well.
Yeah.
And then you also looked at coping, both how people, what I guess the perceptions of what physical therapists thought about successful copers and those that were unsuccessful. Can you give us some feedback on what you found there?
Yeah. So the results kind of showed that patients that were adherent to the rehabilitation program had a positive attitude and were motivated within the rehabilitation process were the ones that were likely to cope more successfully than patients that were, didn't comply or adhere to their treatment program, were dealing with excessive stress and anxiety and weren't motivated to complete the rehabilitation program.
Stress and anxiety is a real kind of through line throughout your paper.
Yeah, definitely. I think it makes sense too, because anytime you get some sort of injury and it affects your life, like there is going to be some unknown about what's going to be next, what the rehabilitation process is going to be like. And as I've kind of found through like clinical education and just like my experience with patients, it is a lot about having to kind of educate people like, this is the rehab process. This is kind of what to expect. And just trying to teach people, like I was kind of saying, just what to expect from this rehabilitative process and in the future. And I think, helping to kind of, create variety helps to keep people's like interest in it a little bit more and keep them motivated, because physical therapists, and from this study, we're really saying that compliance to the rehabilitation helps, and it does help them get better. And so that way they can move on with their life and, get back to doing the things that they love and their hobbies and just their everyday life, especially if they suffer an injury that puts them out of work or, the world's a very different place than when I was doing this study. And, now with COVID and everything, it's so much easier to do things remotely, but at the time it wasn't. So if you suffered an injury that took you out of work and you didn't really have the infrastructure, or it just wasn't as common to work from home, like that's a pretty big deal. It really affects somebody's life.
100%. Absolutely. So you've been through school now, or you're coming to the end of school, your training. How does your education align with what you found in the paper? What were the similarities and the potential differences that you noticed?
So my education was, I think, a little bit different than what my study had found. So one of the things that about my study is the people that had been working as a physical therapist have been working for a long time. And I think the average age was about 50 years old or so. So things have changed quite a bit just within the research field, the educational systems, and what is taught. And I can't speak for what their education was and the things that they were taught. That was kind of outside of the scope of that study in particular. But the things that we were taught now was very much in the sense of like this biopsychosocial model, looking at the wider determinants of health. We did cover things like, communication, how to communicate effectively with patients. We also talked about pain and kind of this like cyclic relationship and how all these like wider determinants can affect. So a person's, just general psychological state, from the day-to-day to like their long-term psychological state, as well as social factors can impact somebody's like stress and anxiety, or even, low back pain is a very common condition that we would see or treat within a musculoskeletal, like outpatient sort of clinic, and how people can kind of just get stuck in this loop of this chronic back pain. But we also talked about things like behavior change, exercise psychology and adherence mode. And then we learned kind of some skills treats those things like motivational interviewing and goal setting and things. So they are definitely making their way into the education system.
Yeah. I didn't notice some of those that you mentioned. I didn't notice in the paper, and I was a little surprised. But as you mentioned, it's from 2018. So it's not it's still a relevant paper as far as time goes, but things may have changed since then.
Yeah.
Bring us up to speed and talk to us about your current PhD work and what the focus there is.
So as I was kind of talking about earlier, I'm co-developing alongside patients as well as healthcare practitioners a self-management intervention for patients living with inflammatory arthritis. And um, the way that we were kind of, or the way that we developed it was just through a series of online workshops and just kind of this iterative process of like, what are your needs? What do you want focused more on in clinic? What were there things like, because the healthcare system, you only have so much time with patients. And what we realized that there was this gap of is like, in clinic, if you only have 30 minutes to talk to somebody, there's only so many things that we can treat, but there's this wider scope of needs of patients that also need to be addressed as well. And as you were saying, we as physical therapists and, even other healthcare professionals are really in this opportune position where we can address these, but how do you address it? You don't have enough time in clinic to talk about all of these things. If you had an hour and a half, that would be amazing, but the system just doesn't allow for something like that. So the great thing about these kind of like interventions and group work that you can do is you can get kind of a large community of people, and how you want to there's a lot of debate kind of within the research field of just like, well, we obviously can't make it all on an individual basis. It needs to kind of be a larger group, but like, where do you draw the parameters around the population that you want to work with? And it's really based on people with similar needs. And so similar conditions, even if they're not the exact same condition, like inflammatory arthritis, for example, it's an umbrella term for, rheumatoid arthritis, psoriatic arthritis, spondyloarthropathies. So there's all sorts of different things that can fall on it. So it's just kind of taking those groups and being like, what needs are mostly the same? And so what can we kind of address in like this intervention that can talk about like more than just the pain and fatigue? Like, what about work issues that are related to that? What about, helping them to communicate with their friends and their family and their healthcare practitioners, and addressing kind of those wider determinants.
So you brought up some really important points there, because when you read research, especially in the psychoeducation realm, around pain and pain education, most of those interventions are usually between 60 and 120 minutes long, with either a patient one-on-one or in a group setting. I think what you're starting to point toward here is that's great. Obviously, that works well in a research setting, but how do we more efficiently deliver essential education to people who need it? And you're starting to, I guess, kind of look at different phenotypes, if you will, of people who could benefit all from the same information.
Yeah, exactly. And it's just like trying to figure out, what can we put within this intervention that kind of talks about everything? And then what are the individual needs that might be needed to address more in clinic, like on a one-to-one basis?
Right. So you're stretching outside the normal realm of just a single intervention, such as exercise, which is what most PTs are taught. But what are the other key educational factors that people need to cope effectively with their condition?
So specifically for like a chronic condition, and even more specifically for inflammatory arthritis, some of the big things that we were talking about were obviously like pain and flare management, because those are kind of the two big ones. But what we're also needing to talk about are like these lifestyle things, which are, you have your rehabilitative exercises, but what about just exercise in general? And, given a specific population, especially for like inflammatory arthritis, they need something that's a little bit easier on their joints. Mm-hmm. So they can't be doing a bunch of like HIIT classes, and it's going to be too hard on them. So what about like the group exercise classes and things like that? And how do you point them to community resources that can kind of help them engage? Or like, what about walking groups? Then talking about, diet and sleep hygiene, because that's hugely going to impact how they feel. And one of the things that was pointed out to me when I was doing this research and these like workshops was somebody telling me that it's great to, affect emotional well-being and these lifestyle factors. However, like I can't do any of that unless these like big symptoms of pain and fatigue are addressed. And in clinic, those are obviously going to be our priorities, is because when we do our assessments, we are looking at like, what are your physical symptoms? What are kind of the other, like, what do you do for work? What's your home life like? We do ask those sorts of things, but we have to prioritize because we only have so much time. And they're just like, and so this was just a really great way of being like, okay, so we can address those in clinic, but this is how we can address these other things and meet those needs for you.
And the interventions that you developed, they sound very education based, which I think are wonderful. Health, kind of whole health education based. How long are the visits and in duration, and what's the intensity of the visit?
So we're still kind of developing it. Those were a lot kind of came out of this, and so I'm definitely still like analyzing all of the data that we kind of collected throughout these workshops. And by the end of it, I should be able to kind of make a recommendation for how long I think that this should be. But really, it's dependent on the clinic and what the clinic's capacity is. And every clinic's going to be different. So some things are going to be better than others. It would be great to be able to deliver all of this in a linear sort of fashion. But if you don't have the capacity for it, you don't have the capacity for it. And you have to be able to prioritize, like, what are the other kind of things that we want.
So after your research now and completing at the end of your program, almost completing your program, what do you see as the role of the physical therapist with regard to psychological and psychosocial interventions? Because there's still some question based on some research and some clinical data that, well, it doesn't fit into our practice, or physical therapists have to be highly supervised for this to work for them. What are your thoughts on that?
What I am kind of coming to terms with and kind of discovering is it's very much on a needs basis of the patient population that you're working with. And every population is going to be a little bit different. But once you have an understanding of that condition and how it presents in clinic, and then understanding how it impacts, their work, if there is even an impact on their work, on how it impacts their like social life, how it impacts, just their day-to-day psychological health as well, then you can kind of start targeting it. And that was actually one of my biggest frustrations when I was first kind of like coming to terms with this, is I was really hoping for like a, like a cheat sheet of this, like, if you see this, then everybody's going to present this way. And these are the techniques that you can use and it's going to fix it. And that's just not the case at all. It's very much on a needs basis. And, it will look different in every population. And even within that population, it's going to look different to kind of every person.
That's interesting. So just because you take let's say a CBT course on chronic pain, and they teach you some of the basic CBT techniques for helping people cope, right? Really what you're saying is that's great. That's a foundation, but how you apply that will change based on if you're working with a population that has chronic low back pain or inflammatory arthritis or women with pelvic health conditions, that there's really a need there to modify the intervention specific for the population.
Yeah, even more so just the individual, it's a great tool to have in your kind of tool belt. And for CBT, I can't speak to that because I don't know that one like super well, but what I have kind of noticed with other ones that I am a little bit more familiar with, like, let's say like relaxation, for example, it is just kind of being able to individualize that to the person. Yeah, and everybody's going to want like a little something different.
Yeah. And that's what's not taught like just in a general course. It's very difficult to teach. When you're teaching to a broader group, it's hard to contextualize it just for the individual patient in front of you, which of course then starts to complicate some of the research studies. with regard to outcomes and things like that. So I think they're all really great points. Alexa, it's been great speaking with you. I'm excited about your work and congratulations, but hopefully by the time this comes out, maybe you'll be closer to graduation or very close to graduation.
Yeah.
Let people know how they can follow you and your work.
So you can follow me on my LinkedIn page. You can just type in Alexa Knuth and I'll come up in there.
Great. So I want to thank Alexa for being here this week. Of course, if you'd like to reach out to her, you can find her on LinkedIn at Alexa Knuth. If you know any physical therapists or other practitioners that are interested in learning about the psychological aspects of rehabilitation, make sure to share this with them on social media, on Facebook, LinkedIn, Twitter, anywhere people are talking about psychosocial aspects of care. I'm Dr. Joe Tata. Thanks for being here this week, and we'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tata. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's integrativepainscienceinstitute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.